Welcome to Let's Get to Work, Reimagining Disability Inclusive Employment Policy, brought to you by the Burton Blatt Institute at Syracuse University. And now, here's your host, Michael Morris.
Welcome to another episode of our podcast series, Let's Get to Work, Reimagining Disability Inclusive Employment Policy. This is a series that brings experts from a government, from the world of workforce development, from the world of public policy, researchers, and so many others that can help give their unique perspective on what we can do to move forward and advance not only employment, but economic advancement for individuals with disabilities. Today, I'm delighted to have as our guest, Ari Ne'eman. Ari is currently a graduate student, PhD candidate in health policy at Harvard, and he has an amazing record of both activism in terms of public policy and now an extraordinary researcher as well. He is the co-founder of the Autistic Self-Advocacy Network, ASAN. He has served as a consultant to many organizations in and out of government, and also is connected with the Lurie Institute at Brandeis for disability policy. I could go on, but Ari, welcome to our podcast series.
Oh, thank you so much, Michael. It's a pleasure to be on the show.
Okay, let's jump right in with some questions. And I'm going to start with really looking at the ADA. The ADA, of course, we're 30 plus years since the passage of the law. And one of its major goals was, of course, advancing economic self-sufficiency for individuals with disabilities alongside community living and independent living. But the progress has not been quite what we have expected. I wanted to get your perspective just in a global way first in terms of the ADA and where we are related to employment and economic advancement.
As you say, the Americans with Disabilities Act was passed with an expectation that it would lead to a influx of people with disabilities entering the labor force. And in the decades following that, the ADA has done tremendous good in terms of rights protection, access to public spaces, expanding access to home and community-based services as opposed to institutionalization. But we haven't seen the kind of progress that we would have hoped on the employment front. And there are a lot of potential reasons for that. Some people say that this may be related to the current state of our benefit programs, SSI and SSDI, and the ways in which they're really very unfriendly to work, make it very difficult for someone to receive any income support while participating in the labor force. Some people say it may be because it's only been really in the last 15 years or so after the passage of the ADA Amendments Act that we saw the ADA enforced to cover a broader cross-section of the disability community. In the years immediately after the passage of the ADA, the law was interpreted extremely narrowly. But one potential explanation that I think after what we've seen in the COVID labor market experience has a lot of weight behind it, a lot of potential validity, is that ultimately there is a need for broader structural changes in the American economy and in how we approach work in order to bring people with disabilities into the labor force. So it's simply providing civil rights protections, even the broad construct of civil rights protections in the ADA, which includes things like reasonable accommodation, really isn't sufficient. But what we needed was a bigger picture, universal design, reimagining of how we approach work in the American economy. Now, that's a very difficult thing to do. It's a very difficult thing to do, particularly on behalf of a specific minority group like people with disabilities. But as it so happens, in March of 2020, we found ourselves in a global pandemic, which prompted some pretty significant changes that we saw embraced by a larger cross-section of the American public because they were for everyone, right? Everyone benefited from telework, either directly, if you were working in a job that permitted you to telework, or indirectly by virtue of the fact that those jobs were now available. And so a lot of people switched from jobs that allowed telework, that did not allow telework, to jobs that did allow telework. We also saw a much tighter labor force, and that really drove increases in labor force participation on the part of people with disabilities, and really created some opportunities to see some of the changes we've hoped to see for a very long time. So,
Ari, let me just break in for a second,
sure.
because we're gonna cover a wide range of your research related to COVID. But I wanted to back up a little bit. And when you were looking at studying the impact of COVID on disability employment, you looked at different periods of economic stress, and you particularly looked back to the Great Recession of 2008. What, during that economic stress period, I want to hone in on what you learned there and then compare it to what you learned in terms of this more recent and still existing COVID period.
People with disabilities really struggled, not only during the Great Recession, but during the economic recovery. In the aftermath of the 2008 recession, people with disabilities recovered to their pre-recession employment to population ratio very, very slowly, particularly as compared to people without disabilities. In fact, we were really only just seeing people with disabilities hit their pre-recession employment to population ratio in the months directly before COVID. So it was an 11-year recovery process for people with disabilities, as compared to only a comparably much smaller period of time, only a few years, for people without disabilities. The lack of sufficient economic stimulus may have played a role. The fact that the economy hadn't adopted some of the broader changes that may be necessary to increase labor force participation for people with disabilities may have played a role. But for whatever reason, people with disabilities recovered from the Great Recession very, very slowly.
And as we look at today where we are, where you're seeing that significant increase in labor force participation for persons with disabilities, can you hypothesize a little bit about who makes up that population? And do we need to learn more about who is part of that increased labor participation in terms of people with disabilities?
As you say, in the aftermath of the very rapid economic downturn and rapid recovery that came with the global pandemic, we could refer to it as the COVID recession, people with disabilities recovered a lot more quickly than they did in the aftermath of the Great Recession. In fact, the employment to population ratio for people with disabilities not only met its pre-COVID recession levels, but has now since exceeded them. And we're seeing people with disabilities see much faster job growth, much faster employment growth, I should say, than people without disabilities. Now, there are some open questions as to why that might be. One possibility is that it's a shift to telework. And in fact, we have seen that job growth, employment growth for people with disabilities is growing fastest, and in fact, fastest relative to people without disabilities in teleworkable occupations, which would suggest that the expansion of telework may be playing a role here. Another possibility is it's just tight labor markets. We see a very tight labor market at the moment. But I will note that, that in prior recessions was not sufficient in order to bring people with disabilities into the workforce. It may be playing a role now, But if that is what's driving this, it may be only opening up those doors because of other kinds of structural changes, like the shift to telework. But then the third possibility, and this is what we have to be worried about, is that rather than people with disabilities prior to COVID being welcomed into the labor force, that what we're seeing is an influx of newly disabled people, whether because of long COVID or delayed medical care or any of the other things that led to increased rates of disability as a result of COVID-19 and its consequences on American society. And we do know that disability rates have increased during COVID. We have reason to believe that the population who's entering disabled status probably has better educational attainment, better prior labor force attachment, and they retain a great deal of that human capital, a great deal of that attachment to the economy when they enter disability status. So that may be shifting labor force participation for people with disabilities simply because of people entering disability status. So we just don't know the proportions of those three explanations. It's an area where we're engaging in some future research, and we're going to be engaging in some future research pretty soon. But those are the three possibilities. It's either the shift to telework, the tight labor market, or the influx of newly disabled people. And if you asked me, if I had to guess, I would say it's probably a combination of all three.
Thank you for helping think about this, and it definitely is an area requiring further research. When you talk about telework as one of those factors that added to labor force participation for individuals with disabilities, can you talk a little bit about that's not evenly distributed across the heterogeneous disability population? Who are the people most benefiting, and what are the kinds of concentration of occupations where telework is very unlikely as a reason where more people could have participated because of the nature of the job?
Yeah, it's certainly the case that not everyone has access to telework. And in fact, in some research conducted by other researchers earlier in the pandemic, it was found that people with disabilities, despite the fact that they could disproportionately benefit from telework, were less likely to have access to it because people with disabilities were more likely to be in low-wage frontline jobs that were simply not teleworkable. So, that is definitely something to be aware of, that there are large parts of the American economy, right? People who work at a grocery store, for example, people who work in retail, people who work in manufacturing, people who work in healthcare related occupations that are just not going to be possible to shift to telework, at least not for the foreseeable future. Now, that presents real challenges because people with disabilities are disproportionately likely to be in those low-wage frontline jobs. Having said that, there are some spillover effects, right? As we see, and I think we have seen this over the course of the pandemic, many American workers wanting to enter teleworkable occupations or wanting to get access to the flexibility in other industries that COVID and the changes in the American economy prompted by COVID have delivered. We're seeing labor markets in those less teleworkable jobs become increasingly tight, right? If you've ever gone to a restaurant or a store and seen a sign apologizing because they're understaffed, you're seeing something that's reflective of a broader trend. That those kinds of industries are really struggling to hire. And it's not because people don't want to work. In fact, we're seeing record employment in the American economy right now. It's because people are, by and large, or large numbers of people are shifting into other kinds of jobs that they like better. Now, we hope that people with disabilities have the opportunity to make the same kinds of shifts if they want to, and to take advantage of these broader changes, and some do. But even those people with disabilities who are not able to make the shift to teleworkable occupations, can benefit from the greater need of these frontline employers, of employers in retail, food service, healthcare occupations, et cetera, to engage in hiring, because they're going to be much more likely to hire people with disabilities. And that's something we've consistently seen in any number of different contexts, whether it's fear or prejudice or concerns about inconvenience or any number of other things that keep employers from hiring people with disabilities and other marginalized groups. Those things, they don't go away entirely, but they're significantly mitigated by the simple reality that they need to fill a job, and there are not enough workers available for them to do so easily at the moment.
You also mentioned telework becomes perhaps more acceptable than it previously has been by employers. And you mentioned, of course, the concept of universal design, which is not just for people with disabilities, but it's for all workers. For individuals with disabilities, can you just tell our audience a little bit about how does that benefit individuals with disabilities that overcome some barriers that they have to employment?
Sure. So let me first speak to the framing that you used, because I think it's really important. As Michael, the ADA really has a fact-based set of circuit tests. Let me rephrase that. As under the ADA, there is not a single list of accommodations that everyone is entitled to under all circumstances. Instead, someone requests a reasonable accommodation. They may be legally entitled to it in some jobs. They may not be in other jobs. And it really depends on this very fact-dependent analysis of whether or not their accommodation is consistent with the essential functions of a given job. And there's some things that are obvious, right? If you are requesting as an accommodation that you get instructions via email and your job is a computer programmer, probably does not violate the essential functions of your job. If you're requesting as an accommodation that you not have to use the phone and your job is as a telemarketer, that probably does violate the essential functions of that particular job. And telework, in many, many instances, for many people with disabilities, was a sought-after reasonable accommodation. But there was a lot of argument between people with disabilities and employers as to if it violated the essential functions of a lot of different occupations. So for any number of different fields, employers felt that an essential function of performing that job was to come into an office every day, pre-COVID. Now, that was something that you could definitely see arguments about before entire companies, entire sectors of the American economy shifted towards a telework approach for everyone. It becomes much harder, I believe, to make the case that someone teleworking in a particular occupation is a violation of the essential functions of that job, when for months, in some instances years, the entire workforce, the entire industry, and the entire company, whatever, was engaged in telework and performing that job. So I believe the shift to telework has really changed the frontier of what's plausible with respect to requesting a reasonable accommodation. Now, it's also the case that many employers have chosen to maintain their workplace flexibility and maintain telework as an option for everyone. And that's where universal design comes in, Michael. It's not just that you can ask for telework as a special disability accommodation. It's that everyone has access to telework, including people with disabilities, and there's no need to fuss about what is legally required under the ADA. You just have access to this as a broader benefit. And a lot of workplaces have shifted in that direction too. Bottom line, all of that, both the broader scope of what you can ask for as a reasonable accommodation and the universal design element of more workplaces making this available, making telework available to everyone, benefits people with disabilities and may reflect some structural changes that we hope will stick even after the economy cools down and the labor market is less tight than it is today.
Staying with that look ahead, from a policy perspective, are there ways that the federal government can do more to encourage and a greater acceptance, understanding of telework, remote work, that now employees with and without disabilities have demonstrated they can perform the essential functions of their jobs in many different types of work settings? From a policy perspective, is there additional guidance, or is what might be done to help promote this? Again, I really like the thought about more so from universal design perspective than from a legal enforcement perspective, although is it a little bit of both?
I think it is a little bit of both, Michael. I think you're right about that. On the accommodation side, EEOC obviously has a role to play, the Employment Equal Opportunity Commission, and it would be good if they were very forthright in guidance to employers that telework should be made available as a reasonable accommodation as broadly as is reasonably feasible. Again, there are certain occupations, retail, frontline healthcare occupations, a number of others, in which it's not feasible, in which it would violate the essential functions of those occupations. But we really should try and press the boundaries to make it available as a reasonable accommodation for people with disabilities who need and request it as broadly as we can. Now, on the universal design side, I would point to the federal government's role as a model contractor and model employer. Which is to say that the more the federal government allows federal agencies and contractors to the federal government to telework, people working for federal agencies and people working for federal contractors to telework in a broad range of jobs in which telework is feasible, the more that will dissipate throughout the American economy. The federal government, it's the largest employer in the country. It's also the largest contractor, and it has just a tremendous amount of power to really shape American labor practices through those roles, even without direct regulations. I would argue that when we think about encouraging a shift to a universal design standpoint, which you most likely can't mandate, right? It's only people with disabilities who have rights under the ADA, or at least accommodation rights. When we think about the universal design standpoint, it's really the federal government's role as a model contractor and a model employer that we should be leaning into.
Okay, let's switch to another area of your research. We're pleased that you and Nicole Maestas at Harvard are part of the research team for the Disability Inclusive Employment Policy Research and Training Center, funded by IDLR, National Institute on Disability, Independent Living, and Rehabilitation Research. And is this, in this other part of your research agenda, you're studying the causal role of multiple policies that promote and or depress employment outcomes for Social Security beneficiaries. Can you share with our audience which specific policies are you studying, and what are you hoping to learn?
So we're looking at a number of different things. One area in which we've been focused in recent years, really over the last year in particular, is looking at the impact of the Affordable Care Act's Medicaid expansions on benefit participation and employment outcomes for people with disabilities. So we're in the process of writing up some results now that indicate that it appears, contrary to some prior research, that the ACA's Medicaid expansions resulted in an increase in people with disabilities entering the Social Security Disability Insurance Program, that particularly for people ages 50 to 64, so folks who are in the older but non-elderly cohort, that the ACA's Medicaid expansion really drove a significant increase in SSDI enrollment. And that's somewhat different from what prior research has found. One of the reasons why we've been able to detect this effect is we have focused in on a specific population. A lot of prior research has looked at SSDI and SSI enrollment among all Americans, but it's really only a subgroup, people with some degree of functional impairment, they're at greatest risk. So in population surveys that the federal government deploys, like the American Community Survey or the Current Population Survey, we use the Current Population Survey, people with disabilities are generally identified via 6 questions about functional impairment. We don't just ask people, do you have a disability? Because people mean wildly different things by the word disability. We ask about, do you have a vision impairment, a hearing impairment, an independent living impairment? And there's specific language to ask about each of those. And even though in the Current Population Survey for non-elderly, for working age persons, the people identified by that 6-question sequence only make up about 7% of the working age public. It's a population that has more than half of SSDI and SSI enrollment. So we looked at them as a subgroup. And when we zero in on that subgroup, that 7% of the population is most likely to be enrolled in SSI or SSDI, we see a significant increase as a result of Medicaid expansion in SSDI enrollment. And that would suggest that people with disabilities are leaving the labor force because of the opportunity that Medicaid expansion provided them to have access to health insurance coverage during the 2-year waiting period that SSDI beneficiaries have from the point at which they start getting SSDI to the point at which they qualify for Medicare. Now, I will say, even though that would suggest that a Medicaid expansion for at least a portion of the disabled population resulted in leaving the workforce, I wouldn't say that's necessarily a bad outcome. We're talking about people who may be in their early 60s. They may have worked very grueling and difficult jobs. They're ready to retire. The primary thing holding them back is they have a lot of healthcare expenses and they don't want to go without insurance. And so opening up early retirement is an option for those people with disabilities. I wouldn't say that that's a tragedy. I'd say in many respects, that's a good thing. We also think we have a little less strong, that's what I would characterize it as, suggestive evidence that there may have been a decrease in SSI enrollment as a result of Medicaid expansion, that by offering people with disabilities access to an alternative pathway to enter Medicaid, that they may have been less likely to go on SSI, which in most states comes with categorical Medicaid eligibility. We can't say that as definitively as we can say that there was an increase in SSDI enrollment, but it looks plausible from our data. It's tricky because since there are relatively few SSI beneficiaries, the program is about half the size of SSDI, that data is a lot noisier. So if that suggestive data is correct, it would suggest that for some people with disabilities, that Medicaid expansion resulted in them entering benefit programs and leaving employment. And for other people with disabilities, Medicaid expansion resulted in them exiting benefit programs and entering employment. It's a very tricky situation. In fact, when we look at employment directly rather than benefit participations, we can't draw any firm conclusions, possibly because the 2 signals that we think may be there may be canceling themselves out.
Which then makes it even more difficult from a standpoint of where my next question was going to go. So from what you're learning, what are the policy recommendations that might encourage people to stay in the workforce rather than leave it for the other types of benefits they're getting?
I actually think the policy recommendations are fairly straightforward here. So first, even though our research shows that for some people with disabilities, particularly people with disabilities in that 50 to 64 range. Medicaid expansion resulted in them leaving the workforce. I don't think that means Medicaid expansion is a bad thing. So policy recommendation number one is still expand Medicaid. It is hugely beneficial from a health standpoint, hugely beneficial from a broader social policy standpoint. People with disabilities benefit in all kinds of ways. And even this reduction in labor supply, we should see that as reflective of a benefit, because if you're 62 years old and you have really significant impairments and are struggling to stay in your job only because you don't want to go without health insurance, I think Medicaid expansion is really a net win for you. But taking that a step further, if we were to ask ourselves, how could we keep those people in the labor force, right? How could we make it possible for someone who may be at the margin of exiting the labor force, and who conceivably requires some degree of income support, requires some access to public insurance, but present really only has this all or nothing proposition of either you're working full time and getting employer-sponsored insurance, or you're leaving the labor force and altogether and going on a government program. I think the big thing that we need is a partial disability option. And folks have realized that for a long time. There's a long-standing problem with America's all or nothing proposition with respect to disability benefits. So the hope is that future policymakers look at this evidence and see that there is this sizable population of people who could be working, who also really could benefit from some level of income support, and create a program that can make those things more compatible. To say maybe you get a partial income support benefit and access to public insurance, but you're still allowed to participate in the labor force to a greater extent than our current program permits. So I think this research really helps make the case for partial disability.
Ari, can you elaborate a little bit further on what would a partial disability option look like?
It's a great question. I have a report that the Niskanen Center will shortly be issuing, looking at the creation of a partial disability option in America's other disability income support program, Supplemental Security Insurance, SSI. And there, and really this is more focused on younger people with disabilities rather than the older people with disabilities, that we're entering the DI program as a result of Medicaid expansion in our research. But the vision that I articulate for partial disability in SSI is first to allow people to choose between applying for the traditional SSI program, which comes with a full, albeit relatively low, benefit level that is intended to reflect someone being 100% disabled, and instead to apply for a partial disability option within SSI that would, similar to veterans' disability, pay them a disability benefit scaled in proportion to their level of functional impairment. For some people, they might receive pretty near to the benefit they would have received under the full SSI option. For other people, they may receive 20 or 30, 50% of that, in exchange for much more work-friendly rules under SSI. So, for example, under the current SSI program, cash benefits phase out at a rate of $1 of lost benefits to every $2 of earnings. It's essentially a 50% marginal tax rate. We propose that under the partial disability option, benefits phase out at a rate of $1 of lost benefits for every $10 in earnings, effectively a 10% marginal tax rate. They also make proposals to eliminate the asset test for persons entering the partial disability option, and also to increase benefit levels in both the partial and the full disability options, since they're woefully inadequate, and a partial disability option is going to be much more meaningful if it's off of a benefit level that at least reaches the federal poverty rate. So, that report, I'm not sure if it'll be out by the time this airs. We'll have to see. But we think it'll lay out an interesting option for increasing labor force participation among a different cohort than we focused on with the Medicaid expansion study, where we were looking at older workers. Here, with the SSI program, since it's a program that's primarily focused on people who do not have a prior work history, we think the introduction of a partial disability option there could create some real opportunities with respect to younger workers with disabilities and potentially increasing the youth disability employment rate.
Fascinating approach, much needed from my perspective. Obvious question is cost. How do you, is there some calculation that this actually, it's certainly not revenue neutral, but do you approach the cost issue?
I think that's a work in progress, and I think we're hoping to have more information on that in the future, but I think maybe ask me that after the report comes out.
Okay, sounds fair enough. You're, from my perspective, brilliant at coming up with new solutions from a policy perspective that can advance employment for what is a very diverse population of people with disabilities, age, type of disability, severity of disability, etc., need for health benefits with greater intensity. What are your next set of research areas or questions that you're going to be pursuing?
At the moment, I'm looking at a couple of projects that are underway that will probably be a part of my dissertation. I also hope will help contribute to the broader discussion on disability and health services research and public programs. One that may be of particular interest to this audience is the impact of Medicaid managed care on employment outcomes for people with intellectual and developmental disabilities. So we know that people with IDD receive significant employment services from the Medicaid program. Supported employment is a major role in helping people with IDD participate in the labor force. In fact, even though people with IDD make up about a third of SSI beneficiaries, they make up half of SSI beneficiaries who work. The reason being, it's a population that is disproportionately likely to both be getting the support necessary to work, but also, frankly, to be working in sufficiently low-wage jobs or low enough hours to still be on the SSI program. So this just raises some questions about what happens when there are major changes in Medicaid and how Medicaid is delivered. And we know that in several states, there were transitions into Medicaid managed care that included services to people with developmental disabilities, which is a little unusual. So we're looking at Kansas and Iowa. Kansas and Iowa were two of the first states to transition IDD services into managed care. Most other states had carved out IDD services, kept them in traditional fee-for-service Medicaid. Kansas and Iowa contracted out through the managed care process, these services, along with other Medicaid services, to private commercial health insurance plans. And our suspicion is shifting the administration of employment services, of Medicaid-financed employment services, like supported employment, from the government to commercial insurers who don't generally have a lot of experience or knowledge about how to deliver employment services. They're quite different from the usual types of healthcare services, probably have a negative impact on employment outcomes for people with IDD. So that's an area where I'm currently doing some research. I hope to have some results in the near future. And yeah, I suppose when I do, we'll have to sit down again and we can take you through those findings too.
Fantastic, Ari. Ari, as always, insightful, provocative, exciting areas to explore in terms of future policy development. Much agree with you on looking at income and asset limits. Love the thinking behind partial disability, similar to the VA system, perhaps, but other ways not so similar. We look forward to continuing our conversations with you and appreciate you joining us today as part of our podcast series series, Let's Get to Work, Reimagining Disability Inclusive Employment Policy. Thank you so much.
Thank you, Michael. It's a pleasure to be on the show.
You've been listening to Let's Get to Work, Reimagining Disability Inclusive Employment Policy, brought to you by the Burton Blatt Institute at Syracuse University. Don't forget to subscribe to the podcast at Apple Podcasts, Google Podcasts, or wherever you listen to podcasts. The contents of this podcast were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, NIDLR Grant Number 90RTEM0006. NIDLR is a center within the Administration for Community Living, ACL, Department of Health and Human Services, HHS. The contents of this podcast do not necessarily represent the policy of NIDLR, ACL, or HHS, and you should not assume endorsement by the federal government.